Hi, and welcome to another episode of SMECO Connects. I'm Tom Dennison. I'm Vice President of Government and Public Affairs here at SMECO, and it's a great pleasure to have another podcast here. And it's funny, we've been doing a lot of these podcasts now for the last several months, and we interview a lot of people internally about what's happening here at the co-op. And today we're very pleased to welcome Albert Zanger. Albert is the Chief Administrative Officer of the University of Maryland Charles Regional Medical Center. It's our local hospital here in La Plata that I have the distinct honor of being on the board of directors for that hospital. And it's, I think it was really helpful, to bring Albert here to introduce him a little bit to the community. He's been out there, he's been meeting with county commissioners and countless other groups, and I think he was very gracious to give us some time today to come in and talk to us. So Albert, welcome, and can you just introduce yourself and tell us how long you've been CAO at the hospital?
Sure, thank you, Tom. It's really an honor to be here with you today, and I certainly appreciate your support and leadership and guidance serving on our board of directors. Yeah, as Tom mentioned, I'm the Chief Administrative Officer. I know that title might be a little confusing. It's effectively the president of the hospital. I've been in this role for about 10 months now, but I've been with the hospital, Charles Regional, for a little over 6.5 years. Mm-hmm. And then within the University of Maryland medical system, for 16 years. So I started up in our corporate office. I worked in some of the billing office, doing a lot of reporting, getting the lay of the land there. Later transitioned into kind of corporate finance, the reimbursement area. So hospitals in Maryland are rate regulated. It's probably in a lot of ways analogous to the utility industry. So there's a state rate regulator, and I did a lot of work on that end for the University of Maryland medical system. So part of that job, I'd meet with the leaders of each one of the member hospitals within the University of Maryland medical system, of which we have them spread out throughout the state. So over the years, I had the privilege of getting to meet the teams at each hospital, get an idea at least of the communities in which we serve. And Charles Regional and Southern Maryland always kind of had a special place to me. When I would come down here, it was the way I describe it was different, in a very good way. So I guess about 7 years ago, the former CFO was retiring. And I remember, my wife and I were driving up to visit my sister, and it was a long drive, so we had some time to talk. And I was talking to her saying, look, there's a great opportunity down in Charles Regional that I'd love to put my hat in the ring for. And we lived outside of Columbia, Maryland, so it was quite a hike. And I said,
yep.
How would you feel about moving? I would not want to be doing a long commute, having a long hours in the office and then the commute. And she said, no, that would be great. She said, let's give it a try. And I was very fortunate to get that opportunity. And I served as the CFO for a little under 6 years. And our former CEO, Noel Servino, was retiring, again, about a year ago. And I'll say when I came here initially, like the thought of, being the leader overall of the hospital, running the hospital, it never really came into my thought process. It was one of those things that over time, as I got more and more involved and got to know more and more people in the hospital, it just started to feel right. The team we have is truly incredible, and I enjoy working with them every single day. Like coming into the office, it's not a job. It doesn't feel like a job. It doesn't feel like work because of the people. And it really has made a tremendous impact.
I mean, it's so gratifying, I would think, too, as the head of the hospital, to know you have several hundred employees, and trying to get to know them, and also just embracing that role as a leader is something you can't really prepare for. So how has that transition been?
Yes, to be honest, it hasn't been much of a transition in this because we're a community hospital. And Dr. Smith, our chief medical officer, he has a great saying, we are a community hospital, not a hospital in a community. And there's a distinction there.
That's a huge distinction.
There is. On the soccer field, the baseball field, I'm side by side. I'm coaching with fellow employees' kids on the team. And, it's truly a community. So even in my former role as CFO, you think of finance, somebody in their office looking at spreadsheets and, not really interacting. It's not that way at Charles Regional because all of us are out and about. We're meeting with the teams regularly. We're walking the halls. Before this role, I know many of the, the nurses, the techs, the frontline employees that are delivering the care at the bedside, know them by first name and they know me. And it's a nice, friendly environment.
I know. And I think that's one of the things that really attracted me to being on the board of the hospital. And it's a volunteer board. And what we do is anything but micromanaging. We kind of oversee things, and we check the financial health of the hospital as well as the quality of care, and the staff is so accountable, and the staff is so transparent about what they do and why they do it. And I see a lot of parallels between the hospital and SMECO. At SMECO, we're members of the community as well. I'm involved in, with the kids at sports, and you see a lot of overlap between hospital employees and, SMECO employees. So I have to imagine, Albert, when you were thinking about coming to Charles Regional, that was one of the things that attracted you, the sort of that Southern Maryland community, the fact that there was such a deep-rooted investment in the community.
Very much so, yes. And like I said, when I was at corporate and I'd come down to Charles Regional, one of the things that always stood out to me, when I'd walk in the doors, everybody was so welcoming. Mm-hmm. People would look at you, they would greet you. There's other areas of the state that, you walk down the hall and everybody's heads down, they're not acknowledging you. So it is a very a great community feel. I say when we first moved here, my wife and I, when we moved down, mm-hmm. It was the first week of living here. I remember coming home from work, and this is a story I actually tell, as we're trying to recruit physicians into the market. This is a story I often tell because it just is one that's really stuck with me all these years. And, my first week here, I come home from work, my wife says, it was, really nice today. I went to, I don't remember if it was Target or Safeway, but she goes, I was walking out to my car and like 2 people looked up and said good afternoon to me and greeted me.
I like that.
And, where we came from, and I loved where we came from too. Don't get me wrong.
Sure.
But you're walking to your car. It's like your head down. You're trying to get there and get in and get out.
Yep.
Just the hospitality and the sense of community is something that's truly unique about Southern Maryland.
Absolutely. So let's dive into the hospital a little bit. So a lot of people recognize the hospital on the plate as Civista. And so how many years ago was it when University of Maryland took over the hospital, and then kind of what has been the advantage of that since that happened?
Sure. So I'd say roughly 16 years ago,
okay.
When it was Civista, the hospital was under some significant financial distress to the point where the creditors, those that held the debt for the hospital, were looking to take it over. And had that happened, it could have been pretty disastrous for the community. So
Absolutely.
University of Maryland Medical System got involved, and my predecessor, Noel Servino, I think, was instrumental in this. They got together, and the University of Maryland they entered into a management agreement where University of Maryland Medical System helped oversee kind of a turnaround, more on a financial side, so we didn't get stuck with the creditor issue. That ultimately led to the affiliation where Charles Regional became a member organization of the University of Maryland. I believe that occurred about a year later. So over the past 15 years roughly, it's allowed us, it's introduced new technologies, new services to this community that likely wouldn't be there otherwise. So starting with something kind of basic is a digital medical record that's integrated with all of the University of Maryland medical systems. So as patients go from hospital to hospital, the information on those patients is readily available. So if you need to go up to receive tertiary care, we have patients down here that have gone up to Baltimore for transplants and highly advanced cancer treatments. All the care they've received here in the community, that information is readily available to the specialists up there. It's also provided us access to world-class academic medicine.
Absolutely.
So as an example, our stroke program, if a patient comes into our hospital with stroke-like symptoms, we have immediate access to, advanced, neurologists up at the University of Maryland Medical Center who can help play a role in delivering that care. We recently introduced some remote advanced fetal monitoring. So, women in our hospital in labor, not only are our nurses and doctors, they have eyes on the patient, but remotely we have specialists that are also keeping an eye on, the fetal monitoring of the baby. So, it's additive things that really, I think, benefit the community we serve.
I mean, certainly just being a part of the university system of Maryland. I mean, that when you say that, you open so many doors, I think, to, quality of care and specialty specialty care, I guess, for lack of a better word. So what do you see kind of as the biggest challenge facing the hospital these days? What do you kind of worry about at night, and what is the kind of plan moving forward?
Sure. I'd say the biggest challenge, which I don't think is unique to us, it's pretty common in all business these days, is the workforce.
Absolutely.
So, we have a big focus on recruitment and equally important retention. One of the big priorities of mine is ensuring we have the best culture. So once you get into the hospital and you're an employee with us, that you want to stay for life.
Absolutely.
So, we've done a lot, and we continue to do a lot of really just making sure that, everybody feels welcome and they're contributing. We're on what's called a high reliability organization journey. So I know we talk about that some at our board meetings, and it's not unique to healthcare. It's in the airline industry. I believe it's in utilities, and it's the ultimate goal is around safety. And
Yes.
our goal at the hospital of zero harm and being the safest health system in Maryland. But the tenets of that, one of the big tenets in that is what they call psychological safety. And it's creating an environment where anybody working feels comfortable speaking up if something doesn't look right. And it's giving everybody a voice. We are not a hierarchical, type of organization. It's not a top-down culture. We're really looking for everybody to contribute, and creating that environment where every employee is empowered to make it a better place to work, a better place to deliver care, and the best place to receive care.
And I know one of the challenges that was at the hospital was the emergency room. And I think it's, one of my proudest achievements as a board member has watching the expansion of the emergency department and sort of providing that top of the line space, of course, and just work environment for the folks who go to work there every day. And that has to be one of the big, kind of accomplishments, I think, for the hospital over the past 10 years or so.
Yeah, so that was a significant investment. So we completed the renovation, addition, modernization, if you will, about a year ago. I think it finalized in August of.
Yeah, I remember. Yeah, it was. Yeah, getting through that very final stages was always fun.
It is fun, and it was but disruptive throughout the process.
Yes.
And we're very pleased that's completed. It's added 11 treatment spaces. We've been able to connect, there was kind of two distinct areas of the emergency department before. Now it's all one connected department. We added an internal results waiting area. So, you get worked up, and we're just kind of waiting for a test result to, help dictate where you would go next. So instead of going back to the lobby, you're able to stay back in the department, but then also you're freeing up that bed, which, you don't really need at that point for the next patient coming in, so we can deliver quick care. The triage process is something that would be great for, listeners to understand a little bit, because I know ED wait times is a big topic. And, we have to triage as people come in the door, and the sickest come back first. those that are at risk of losing life or limb. We're actually the busiest emergency department in all of Southern Maryland, and actually including Prince George's County. So we see about 50,000.
50,000
a year. Mm-hmm.
That's amazing. That's a huge number.
Any day, and the fluctuations, that's what makes it challenging, is the fluctuation. So we know, we study the data. The team there is constantly looking for ways to tweak the process to improve. And we know typically Mondays and Tuesdays are going to be on the busier side. But the variability is what's really difficult. And, we try to staff as best we can to where the volumes are, so that on busier days we have more people there to get folks in and out more quickly. And then the slower days, we try to shift the resources to where they're most needed. But just as an example, even on a day where we would on average expect, say, 130 patients, some days it could be 100, other days it could be 170. So it's not like we're talking about a 10 visit difference. The swings can be pretty extraordinary, and we do our best to adjust as needed.
Well, and certainly I've seen that. I know, just looking at the data that is provided to me as a board member on the number of people who come in and kind of that process from when they come in to when they leave. And it is just like with the utility, we're always wanting to get power back on as quickly and safely as possible. We always have to look to adapt and change and make the adjustments necessary to help improve our service. And I know that's something that you all do. I have to bring up something that is such a something that it will always resonate with me as a board member. So I was put on the board in January of 2020. And as you can imagine, March of 2020, when Sonia became president, we were in the midst of COVID. And so I can tell you, as a board member, the level of professionalism that went on at our hospital is just something I've always been so proud of, to be a part of it in a very, remote kind of way. But talk a little bit about COVID. I know it's hard we could have the whole podcast about COVID, but how your staff, well, you were CFO at the time, but how the staff kind of came together and made us so proud.
Mm-hmm. Yes, I'd say in the beginning, there was a lot of angst because, as I think everybody can recall, there was just so much unknown. And we, in partnership with the health department and EMS, we did a lot of planning in the beginning. We were anticipating this surge of patients. We went around identifying other areas that we could treat patients with, and obviously staffing was always a concern. The safety of our team was a concern. We are fortunate that we had a lot of tools available to us, such as they're called PAPRs, but basically like the spacesuits.
Oh, sure.
We had gotten those years prior, and through like the Ebola scare, I believe it was before my time at the hospital. But we were fortunate to have some of the tools that a lot of others did not have. And really, we wanted to prioritize our team's safety, prepare for what we thought was going to be an influx. But then actually, when the pandemic started, it was actually the opposite. Everybody stayed away.
Right.
And that was kind of took us by surprise. And then, when we fast forwarded to, I believe it was, December of 21, January of 22 is when we had the big surge, and there was just an influx of patients. So normally admitted patients kind of in beds upstairs, on average, it's roughly 80 a day. And we peaked at about 120, 125 during that January. And, again, keep in mind, we had, a little bit of construction we were kind of planning to do for the emergency department. So there was a lot of things in flight, but the team, everybody just responded really well and put in a lot. We had people deployed in departments, assisting that they previously worked in, but now they were in a different role. So there was a lot of flexibility and adapting by the team. I'll say too, the community support we got during that was just truly inspirational. Businesses donating food to our teams,
which is a really nice thing to hear.
It is.
And I also know that members of the leadership team who were nurses were actually back on the floors doing what I'll just call the bread and butter kind of work that was so necessary for people. And because there was such a shortage of qualified people, and just seeing that level of commitment was something to really be proud of.
Very much so.
Yeah.
Yes.
Well, let's hope that that's behind us now. And Albert, tell us, we're kind of getting towards the end here. What did I leave out? What can you tell us maybe about the future or some of your plans going forward that might be interesting to our viewers?
Sure. So maybe I'll start with, because I know, SMECO serves all of Southern Maryland, not just Charles County in which we're located. I think folks should, it'd be good for them to know that Calvert Health, MedStar St. Mary's, and University of Maryland Charles Regional, we partner together on a lot of things. So while we may compete a bit, we actually pull together much more so to partner to serve the needs of Southern Maryland. So, the three of us have developed what's called Chesapeake Potomac Healthcare Alliance. We have a home health agency, joint venture, a rad-onc company, Chesapeake Potomac Radiation Cancer Center, right, with a location in Charlotte Hall and one in Waldorf. We're expanding the Waldorf site and looking to grow that. So we come together on a lot of things. So I think the residents of Southern Maryland should feel good to know that all three hospitals work together, and we're not trying to outdo each other. We're really trying to collaborate and make healthcare better for all the residents here. In terms of the future, at Charles Regional specifically, Charles County is growing rapidly.
Yes,
so, the emergency department last year was a major expansion. We're continuing to look at expanding the campus, expanding the services we offer. We have a growing medical group, so office-based care. We expand primary care. We're looking to put up new sites in the region for primary care, trying to hire in more specialists. So we have a neurology that we expanded, gastroenterology, general surgery, behavioral health. We're trying to provide the services out in the community. Women's health. We just recently stood up a midwifery program for women care. So we're looking to do as much as we can and expand in every area possible to serve the needs of the residents of Southern Maryland.
And that way people can stay here to get their care. They don't have to go up the road. They don't have to go into D.C. or Baltimore to get that specialty care or a certain level of care that they couldn't get locally. So I think that's really good to hear, and that collaboration is also really a positive thing.
Mm-hmm.
So with that, I want to thank you, Albert. Thank you for what you do in the community. Thank you for all of the staff at the hospital who, work day and night to serve the community. And most importantly, thank you for your friendship. We've been friends now for my time on the board. It's been a real pleasure, and we really appreciate you coming in.
Yes, well, thank you very much for having me.
All right, thank you.